you for coming back to the second day of the Achieving Policy Impact course. So I'm going to start off just by doing a quick recap of what we covered during the last session, and then kind of do a little bit of an overview of what we're going to cover today, if that's okay with everyone. So just a reminder about who we are. Again, my name is Coranda, and I work at the Alliance for Useful Evidence at Nesta, where I lead trainings and capacity building initiatives all around how to help get evidence used into decision making. Gigi's here joining us, and she's going to be helping a lot behind the scenes with any kind of issues or links that don't work. Feel free to kind of message her or me, although I might be distracted, so she's probably the better bet. And Deanna, who could not be here with us today, she's helped us design everything, make it user-friendly and interactive. So thanks to her. And of course, Audrey, who you all know, has helped us, working with us to make sure that this course is as great as it can be. Just to give a quick overview of the learning outcomes from this course. So in the first kind of day, we looked at lots of different thinking around how actually evidence does get used in practice. But today we're going to be thinking a lot more about how we put these different engagement mechanisms into practice, specifically when working with different decision-making bodies. So we're going to think specifically about government, parliament, and the third sector. We're going to take our research questions and think about the problem that they're trying to address and use that as the means through which we can explore the broader context in which our problem takes shape and think about how we can find that common ground between our work and decision makers' work to then use that as the basis for effective kind of evidence-based policy collaboration. Last session, we talked about navigating power and complexity within the decision-making process and reflecting on the role of research impacting your work. We're going to think today, there's going to be a lot of kind of hands-on worksheets and activities using the course resource pack. If you have the one that you used last week, that would be great to kind of build off of, because I think that's a good take-home resource for you to just take all your notes in and have all of the kind of outputs from this workshop in one place. But if you don't have it, let us know, and we can link you another copy of that resource sheet. And we're going to keep on kind of bringing in examples of what research impact can look like in practice across different decision-making bodies, using lots of different case examples with a lot of kind of different researchers at UCL specifically. So yeah, again, today is around how we're going to start off by thinking about how we pitch our research, use some time to reflect upon the role of impact in our own work, explore that problem framing element, and think about how we understand different audiences so that we can better tailor our pitch and better tailor the kind of relationship building activities that we use with those different kind of decision-making bodies. So again, kind of reflecting on what we learned last week. So we talked quite a bit around how to navigate the politics of evidence-informed decision-making. So I think in providing that kind of how to engage in different levels, oftentimes that hides the kind of uneven opportunities, the incentives within different institutions, the different payoffs for engagement, and the complexity of what kind of policy actually is in practice. So we walked through some different ways to cope with that complexity and to kind of map that out. And in your resource practice guide, we have a kind of toolkit for you to ask different reflective questions, understanding your actors, understanding what the best ways to engage with them might be. We talked about these 3 generations of thinking on research use. So how we can engage with different bodies from a linear process. So publishing our research in high impact peer-reviewed journals and expecting them to kind of be responsive to policy needs and expecting them to be used. We talked about the relational process. So the fact that a lot of this comes down to personal relationships and networks and that ability to actually be in the same room and share that knowledge and develop a working relationship with different policy partners. And then we touched on some of the different systems that really influence that ability to create relationships in the first place. Things like the research excellence framework, things like academic career incentives that really help kind of drive our ability and our capacity to engage. We started going through this wheel, and we'll kind of finish it off for the rest of the day, which was based on a systematic review of like what works with academics to actually engage with policy. So thinking about how we understand those policy processes and understand what are the key norms, what are the key incentives, what are the key operating environments and problems that policymakers deal with, so that we can think about how our research fits within that. We talked a bit about how to do high quality research and the kind of differences that exist between what we consider to be high quality research and what decision makers are actually looking for using that aorta framework in the course pack. We talked about some of the importance of making research relevant and readable. And we'll come back to this a bit today in thinking about our pitches and thinking about how we tailor those pitches to different audiences. And we explored about kind of that accessibility and that entrepreneurial spirit of being accessible, of creating these kind of iterative relationships that allow you to kind of create that stronger link with decision-making bodies so that evidence can be more responsive to those needs. We talked a bit about the honest broker issue advocate role. Is your role as a researcher to present the clear, hard kind of facts of a certain situation, or do you care about a specific issue and want to be the representative of your field of study, helping kind of shift decision makers towards what you think might be the best course of action based on your own priors? So before we're going to finish off the rest of the wheel today, but before we do, for those of you who did the homework assignment, so to come back to this wheel of influence, as it were, and just kind of building on kind of how we improve outcomes through better decision making with different mechanisms for engaging with policy. One is around building those relationships and ground rules for policymakers. And you'll hear me say this a million times: relationships, mainly because it is kind of what's been shown to be the most effective thing in changing people's minds and making decisions. But I think that process of building the relationships is not always easy and is not. Yeah, sorry. This is the wheel that we're coming back to, and going into the kind of how we build relationships work. And it's not always kind of straightforward as to how that process takes place. And so something that we at the Alliance have really championed is that kind of research on research use. What is it that makes for that effective relationship building between universities and between decision makers? And so one of these projects was called the Science of Using Science. And basically what this was a systematic review of systematic reviews. If anyone isn't familiar with systematic reviews, although I expect Audrey, you're kind of the expert in this area. It's basically kind of taking the insights from many, many, many different studies, focusing on a very specific research question, and bringing all of that insight together around that specific question. So what is the kind of body of evidence around this? And so this is what the body of evidence is saying around the science of using and communicating science. So we have kind of these 6 different categories of what was found to be effective within this process. And these are grouped within kind of this framework, which is developed by Dr. Susan Mitchie, who's at UCL and who I'll share more info about in a little bit. But it's all around kind of capability, motivation, and opportunity as levers that you can pull to help kind of change behavior towards the use of evidence. So capability is around building awareness of different research methods and practices, and how they work. Also around agreement. So what is our mutual question of interest? What are the commonly agreed kind of problems and terms in a specific area? There's that kind of motivation element. So are different decision makers capable of accessing different different research that fits their different needs? Do they have an easy ability to interact with different academic stakeholders to then kind of respond to their current needs? And the opportunity piece. So what are the structures in place? Are there actually, do different kind of, do people have the skills and see the kind of pathways for influence that might exist within their own institutions? So just to share kind of a couple of these, so maybe kind of digging into this agreement bit, which is what we'll be focusing on, I think, a lot of today. And that's around, again, building mutual understanding and agreement on that policy relevant question and the kind of evidence needed to answer them. And I think a good story that captures this is that I used to work in international development and running big impact evaluations, big randomized control trials in the field of development. And I had been organizing this big conference in Tanzania, bringing together all of these kind of local institutions and academics to then present their rigorous policy research to a crowd of about 200. And part of that, we had invited different policy stakeholders as well, thinking that, okay, if we have people in the same room, then maybe we can create some different research partnerships and think about how, and hopefully some of the research that is communicated will be used, and that conversation will start with the different policymakers that were in the room. So I thought the day was going great. We had different presentations on health, on water and sanitation, everything. But at the end of the day, we had a panel on, on building effective evidence and policy partnerships. And in the room we had a minister from the Ministry of Health, and she asked for the microphone, handed the microphone, and she says, you know, today has been absolutely great. I have absolutely loved hearing about all of your different research projects from X to Z. It's been really fascinating. But in the next month, I have to make decisions on X, Y, and Z. Can anyone in the room tell me what I should do on these 3 decisions? And the whole room was just like, boop, silent, nothing, no response for you. And I think it kind of goes to show that, you know, despite the fact that it was a great kind of networking opportunity, and that these academics were able to share their research, really, at the end of the day, it wasn't what she needed in that moment. Yeah, Audrey, I'll try to speak a bit louder. My headphones are a bit quiet, but I'll try to work on it. But I guess with that story, I think the question is thinking about the types of interactions that you have and the purpose of those interactions. So different conferences might be for the sole purpose of sharing different research insights and sharing kind of all of these different trials that happen in a particular field. But that purpose was not to influence policymakers. That would have involved kind of that structured interaction. So in a separate conference that I've run, what I did was kind of ask everyone that attended that conference beforehand, okay, what is the policy problem that you're working on? What do you care about? What is your priority? And then during that conference, match those different people together, both academics that had expertise in that particular area and the policymakers who wanted to kind of design and deliver policy in that same theme, and then kind of provided that financial incentive, again, that research grant afterwards, to then work together towards that particular goal. So this next piece is around being entrepreneurial, and I think a lot of the advice we see projects an image of like this daring, persuasive scientist, comfortable in policy environments and always available when needed. And I think that is something that is a difficult kind of thing to always imagine yourself in those shoes. But I think it's important to think about that confidence in becoming able to convince people that a shared action actually is possible, and that real tangible impacts are actually deliverable through decisions that decision maker can take. And if you don't feel comfortable doing this, then maybe team up with different networks who can speak on that behalf, or different knowledge brokers who might be able to help you present that and communicate that work. So just to give an example of a kind of another kind of impact case study of pathways to impact. So this is Dr. Sohair Elmeel. So if anyone's heard of her, please feel free to chip in if you've worked with her before. And basically, she has helped kind of pioneer the entire field of neuro-urogynecology, and started off kind of in the practice of gynecology, upscaling surgical access and patient safety working across different international organizations such as WHO, USAID, on improving both surgical management and competency-based strategies. And so through this work, she has really kind of started to advocate for different forms of medical attention as well as different practice. So an example is the work that she's done on tension-free tape, which was meant to support incontinence, but reality has led to kind of mesh dissolving and causing internal issues that can only be solved via surgery. So she's kind of really developed this field, brought to attention this issue through this commonly used kind of medical practice about the adverse health effects through this. And she has kind of advice, and I guess like through what happened is that people came to her with these cases, and she started to realize that this was a wider scale problem, and then became sort of an honest broker and an issue advocate in this field of neuro-urogynecology. So advocating on behalf of better practices to prevent and bring awareness to that the kind of negative health effects of mesh implants. So giving evidence in House of Commons to all party parliamentary groups, working with UK charities and the Foundation for Women's Health to help kind of create new guidelines and practice around mesh implants overall, and also how to treat them through surgery if they have kind of that adverse health effect. And she has also advice for early career researchers, which is don't look for a problem you're interested in. Instead, see what people are coming to you with. Your research should come from your patients, not on your patients. So yeah, she's a really kind of fascinating, has an amazing career, and we'll share more info on her.
Yeah, I was just gonna say that Suhair and her colleague Lori Romanzi, who she works with on these projects, joined us for our very first episodes in policy seminar we had in July. And I'm just including in the chat a link to the blog that I wrote up with Suhair and Lori about the seminar, and it goes into things more in depth, how they've engaged with the stakeholders, as well as how they went about like enacting policy change. So I'll include the link in the chat here.
Thanks, Audrey. That's amazing that you were able to pick more of her brain. Amazing. And this next piece is around kind of reflecting continuously. Do you want to engage? Should you engage? Is it working? And I think in order to kind of dig into this a bit and use this course as an opportunity to reflect on your own motivations and the degree in which you hope to engage with different policy actors in different aspects of your work, we're going to kind of do a bit of a breakout session. And this is really just kind of posing the question, like, what are the personal barriers that you feel exist in policy engagement? curious to hear how your conversations went and some of the barriers that came up in conversation with each other. If anyone wants to share.
Yeah, I can share what we talked about. So we talked a bit about language, how sometimes policymakers seem to use a completely different language, especially if you're not speaking in your kind of mother tongue, then there's an additional barrier there already. But particularly like there's a lot of acronyms, and sometimes it can be quite hard to follow discussions as a researcher. We talked about not having the right networks, not feeling like we have the right connections, and feeling as though other people in the field maybe have better access to those than some of us. We also talked about waiting for the right kind of policy window, like that there's kind of a time, like at the moment, policymakers are understandably really just interested in COVID research, and if you're working on soil health or something, then you're going to have to kind of wait until the right moment, and that can be quite a short window because policy is quite fast paced. And so if you're not kind of ready to go with your policy engagement when that window comes along, then you might kind of blink and miss it almost. We also talked a bit about whether we ourselves were at the right kind of stage of our career to engage with policy, and whether you could engage at kind of any stage, or whether you need to be like a bit more senior. For one of us already engages a lot with policy and in fact works in policy, so we were thinking more about the barriers that she had to overcome to get to where she is now.
I wonder if whoever that was, if you'd be willing to share maybe some of what those barriers were that you overcome in your current engagement.
It was me.
Thanks, Rita.
Yeah, I think a lot of the things that Rachel mentioned were the things that we discussed. I think first it's challenging to do the transition because if you want to work in policy, they always ask you to have experience, but to have experience you need the chance to work on it.
Yeah.
How did I start working around policy? It was more around actually science diplomacy, because during my PhD I was leading an association that represents the Portuguese students in the UK, and that's how I engaged a lot with the Portuguese government and diplomatic bodies around science diplomacy, and then I got interested in policy in general. So I decided that I would look for opportunities. So I landed an internship at the European Commission. So I spent 6 months working in Brussels for the scientific advice mechanism. That is a team within the European Commission that gives independent advice directly to the Commission of Science and Innovation and Research, or to the European Parliament. So we have a group of high-level researchers, and it's either reactive or by request. And that's how then I got the job that I have now, that I'm at the interface and I'm kind of the bridge. So I work in a team at UCL, it's called Policy Impact Unit. And what we do is exactly try to bridge the gap between the research and the different stakeholders, parliament, government, NGOs. And it's to support the researchers in writing up in a way that is understandable for policymakers, come up with a calls for action, write policy briefings, organize roundtables, and try to make this engagement easier in a way. Yeah, and I think what Rachel was saying, the language barrier for me, that was essentially in the European Commission, because they use so many acronyms. So during my first month, I think I kept having question marks on my notebooks. It's like what they are exactly discussing, no clue what this means. But yeah, I think with time, you just get used to it, and there is no problem in also saying, well, I'm sorry, I don't know what that means. Can you please explain?
And maybe it is that like, over time you kind of feel more comfortable to ask those kind of clarification questions. And on the other side too, people ask more clarifying questions of you too in terms of technical language, I imagine. So to share maybe before that, to share some of the things that kind of I've come across, but it'd be great to kind of see if this is similar to some of what you discussed. So one is around availability and accessibility. So thinking about like who you can tap into to learn about these processes. And Rita, it sounds like, you know, by joining that kind of network, that served as a kind of useful launch pad for you in this process. But you might think about like who is it at UCL, be it the kind of policy impact lab, be it through Audrey, that you can tap into, learn about these processes and start to become engaged. The relevance question, this didn't come up as much, but thinking about like if what people are asking for is different to what the research you're producing might be. That confidence, right? So knowing what those acronyms are, or if you walk into a room of people that you haven't met before and who work in a completely different field, it can be quite daunting. So it's maybe the process of having that iterative kind of engagement or developing that relationship can help with that confidence. Knowing where to start. Knowing where to start, I think, around personal barriers. Yeah, Yasna, great. The time element of things, I think, is really, it can be quite a barrier in that it takes a lot of time to develop these ongoing relationships where that confidence is slashed or the confidence is built up, not slashed, and where you're able to kind of participate in these networks and follow that kind of pathway into the point where you're engaging in EU Parliament. And so I think that's a question for us all in terms of the time that we want to commit to it, and reflecting on that and putting aside that time if that's something that we do want to do. And we also kind of talked about power, so navigating different power relationships and imbalances and overcoming that. Yes, I don't know if you want to kind of share more of what you discussed, or if anyone else wants to bring in more that maybe isn't necessarily here.
Well, I think it would be more around accessibility in terms, I think I'm a researcher myself, even if now I'm working, but I'm writing up my PhD as well. And if you are used to the language and to the scientific background, I think sometimes it's challenging to put yourself in the policymaker shoes. But you need to think, okay, they studied history or they studied philosophy, and they come with an essay on philosophy, I'll probably won't understand either. But since you are so embedded in your own environment, I think for me, one of the biggest challenges to take a step back and think, okay, maybe we can't delve that much into this issue. It has to be more clear and more basic. Otherwise, people will just get lost and lose their interest. And I think that's one of the key skills we need to work around with the researchers. Work with plain language. I would say, just think of a play summary, almost if you're talking to a kid or someone on the street that knows nothing about your research. That's the way we have to present it.
Mm-hmm. Yeah, 100%. And it'd be great, Rita, too, if you could share some of the kind of work or any resources that you have through the Policy Impact Unit. I think that'd be great if you can.
Yeah, sure. I'll post the website on the.
Thanks. Anyone else kind of have any reflections on this or other barriers that we might not have discussed? Yeah.
Yeah, I like just to add a little thing that we need, probably, I don't know if it's a personal challenge, but probably we need to be aware of, because through the experience, I've been learning some stuff about how to control your emotions, because all of us are basically humans and we work together, and we have some emotions or reactions to specific, I don't know, our decisions, or how the things are done, for example, how decisions are made. So I would like to, I don't know, if just to add a little bit about how to manage first reactions. Everyone is just we're humans, and also how to manage some bias, for example, and how to be aware of all of us could have bias, and how to manage that kind of thing.
Yeah, I think that that's a really great point around that kind of controlling your emotions around decision making process, but also there's the element of like appealing to the emotional side as well. So thinking about the fact that we all are human in the first place, and maybe thinking about like maybe a particular problem that might really pull on the heartstrings that you can use without that being some sort of kind of I don't know what the word is here, but without twisting that in a perverse way, right? So there's I think with biases and with that emotional appeal, I think the first thing is that first kind of understanding of the fact that we all are human, we all do have an emotional side, and we all have biases, whether or not we like to admit that fact in the first place. So I think it's about using those, what we can learn from behavioral insights, be it around how we can conduct our messaging in a way that's easy and simple and relatable, or maybe how we conduct meetings and have conversations, and the fact that, you know, the first person to raise your hand in a meeting room is likely to kind of set the tone for how others participate within that. So maybe what I could do is share some behavioral insights that I do know of with the group on the chat, and if anyone here too has dug into that space, Yasna, if you have kind of experience in that too, it'd be great to hear, you know, what you've done to kind of mitigate against that, or to help others mitigate against that as well.
Yeah, well, I don't have too much experience, but I think, for example, one thing that last year happened to me, that I wrote a policy brief paper for policymakers in Chile, and unfortunately, we worked together before launching this event or this policy brief. But at the moment of the event, nobody of the Ministry of Health, for example, went to that event. So it was like, oh gosh, we worked together, so why are you not here? Why we're not discussing? So it was a little bit disappointing. So I think I learn now. I think about this process, the entire process, and I'm learning a lot using your information, etc. Because we need to understand what happened with other another person, why that situation occurred, etc., etc. So instead of just getting angry because of the situation, then I need to think about, okay, so what happened, and just trying to, just to think about things, and not judge some people before I process all this information.
Yeah, I really like that. You know, it's in that moment, you're probably feeling really upset that they didn't show up, and being like, why aren't you here as part of this partnership? But also knowing about, you know, maybe our own times that we haven't been able to show up, and the kind of workloads that we might have had, or you know, family emergencies, or, you know, own overload. Like they're people too. So maybe it's the kind of, again, appealing to the human, you know. is everything okay? You know, what happened, and maybe are we able to pick this up at another time? And you know, not always will you get a really kind response back, but I like the idea that you start from a place of empathy and understanding to then continue that relationship following.
I've had a similar experience. I'm also coordinating a series of roundtables on artificial intelligence, and we've invited two lords from the House of Lords and an MP across some of the different seminars, and all three said that they could come, but then on the day of, then had to cancel because they had other parliamentary business, and they sent their regrets and said they really wanted to attend, but I think because especially now their schedules are so crazy and things are coming up, pressing things are coming up, they're just pulled in a lot of directions, so it's kind of hard to get a hold of them, right?
And how did you end up kind of responding to that, to them not showing up, or were you able to continue the conversation somehow?
Yeah, so we ensured that like we sent all of the sort of the policy commentaries and the briefs resulting from the discussion to them. I actually did receive feedback that one of the lords who wasn't able to attend referenced our final report in a meeting he had. So that was really great to hear.
That's amazing. So like, you know, even if you didn't have that in-person time,
yeah,
I'm sure that they felt, you know, sad that they weren't able to make it and just, you know, conflicted. But that's amazing that was cited. That's really great. Anyone else kind of have maybe stories of things that they've encountered and how they've overcome them? Of an exercise here around exploring what impact can look like in your own work, and kind of reflect on how you currently make decisions around kind of all of the different things that you have responsibility for within your own role, and reflecting on what motivates us to do this work in the first place. So we'll do this in our breakout rooms, and we're going to be using this worksheet, which is slide 16 in your course pack. And essentially, hopefully we can kind of just take some time, both as individually and kind of in a group, to reflect on our different motivations for research impact, and thinking about like, what is it that you want to engage, and why do you want to engage in the first place? What kind of benefits do you have, does it bring to you and your career, and what ways do you think what forms and what ways do you see that this could happen, and research impact could take shape within your own role? And maybe you want to just kind of use this to think about maybe your own values and how those reflect on it, and what's at stake within this. So we'll do this for about 10 minutes in our breakout rooms. Any kind of, and this is just, again, just an opportunity for you to think about maybe what are the different things that I have to think about as a researcher? What are my different kind of motivations for partaking in this work? And hopefully this is just a good kind of reflection point for you to kind of take with you, and as you move forward, and as you decide how much time you're willing to put in, and the kind of engagement work that you'd like to do. Any questions before we break out? So in this next kind of session, what we'll be thinking about is that understanding how we can tailor our engagement mechanisms and our kind of communication to the needs of different audiences, and specifically working and thinking about Parliament, government, and the third sector. But before we dig into that, I think it's really important to think about the problem at hand and how that might relate to our audiences. And in some of the pitches, I heard kind of how the research that's being conducted can be influenced by so many different factors, and also have so many different effects that go beyond just the research that we're thinking about. So I think thinking about back to kind of day one and coming back to this, is that policies can be informed by a range of different research and stakeholders. Fun little comic here of how people can come at the same different problem. So the question is how can our problem frames fit those needs? And I'm not sure how many of you are familiar with theories of change or logic models, but this could be really helpful in breaking down your research question into different kind of pathways and different kind of thinking about how different causes and consequences can fit into your problem definition. And you're probably quite familiar with this in terms of identifying your research question and working specifically within that. But I want to take this opportunity to open it back out again and think about what those different evidence and consequences for different causal mechanisms within your own research question might be, because those can be a really good starting point for engaging with different actors. So here we have kind of an example that talks about body size and perception of body size. And you can see how these three kind of core findings can be broken up into sub kind of standards. And maybe one of these sub themes might be the basis upon which that conversation can happen. Here's another example. This is from the Center for Homelessness Impact, which is a What Works Center in a UK What Works Center network. And it's basically serving as the foundation through which we know where policy change can take place. So this is specifically around landlords' propensity to evict or deny tenancy. And so you can see how some of these different kind of elements of this. So reasons could be around late payments, cost of management, maintenance and damaged property, and how those can be broken up into different really interventions or different innovations within this that may or may not have different evidence bases and that may or may not inform kind of homelessness policy around this area. So what are the levers that can be pulled within this problem to help change the way that local authorities respond to the homelessness crisis in the UK? So I think when we're thinking about our policy question, I think it's important to think about the fact that the link between the policy and the expected outcome is about these multiple causal pathways that are really understood in relationship to different contexts. And so we can think about asking ourselves, what is that context? What is that expected outcome? What are these multiple causal pathways? And how might I pick these out in the way that I communicate with these different partners? And here too, thinking about the way that the problem is framed and how the research conducted is relevant for that problem, and who's identified that problem, who's participated in the identification and in the kind of sharing of that problem as a whole. And to do this, what I hope we could do is do a little bit of an activity where we think about what that problem is. And some of this you might be thinking about already kind of in the context of your own research in terms of, I think this is a problem which leads to these effects, which could have all of these adverse thinking. But a helpful framing could be also, this could lead to, which can also serve as that common ground. So an example we might think of, just to illustrate this a bit better, is perhaps the lack of inclusion within the London transport system as the problem. So we can think about that in the form of maybe physical accessibility, in terms of lack of social interaction on the tube, and accountability, especially in crowded trains. And maybe we could break that down into direct causes. So why is the tube site of a site that has this lack of accessibility? Why is this a space of problem in the first place? You think about the fact that maybe it's a 150-year-old system without elevators or accessibility markers for the visual and hearing impaired. And we could think about perhaps the fact that policymakers and urban planners have not made this a progress. So people had not made progress in making people feel safer on the tube. That it requires investment into infrastructure in order to ensure this accessibility. And then we can think about the effects as well, not just kind of the exclusion of transport, but how that might be taken out. So, who is able to have that easy accessible transport, or who feels more comfortable on the tube compared to other people? What effects does that have for commute times and ability to go to far away job sites? How might that affect kind of workforce participation? And who's a better advantaged as a result of the current kind of status quo framework of status quo of how the tube's set up and the safety measures that are in place? Think about who's more likely to experience harassment as a result of this, and how might policies then be addressed specifically based on those groups that are more likely to experience that problem in the first place. So quite a kind of transport focused kind of problem, but hopefully as a group we can think about, and this is again in our course pack on slide 19, think about your own research question and the problem that it's trying to address, and some of the direct causes that might be part of that, and then some of the adverse effects that could also be part of that as well. So for the rest of the day, we're going to be exploring 3 different kind of decision-making bodies: parliament, governments, and the third sector. But Audrey's really kind of covered a lot of the different kind of ways that you can engage with them, and kind of given an overview in the Policy 101 course. So what we're going to do instead is take a look at some of the different personas that exist or that could exist within these institutions, and use that as the basis through which we can think about how our pitch might differ when we're engaging with these different audiences. And it draws upon some of what we've been talking about already in terms of kind of engaging with the emotional side and thinking about what the background of a certain person might be, or where their interests might lie, or what interests they have both in their job and externally, and using that as a basis through which relationships can be made. So I'm going to give an overview of these different personas, but really we're going to kind of read them more in depth in our breakout groups, and then have a worksheet for you in the course pack through which we can kind of think about each of them and tailor our pitch to them. So starting with Parliament, this is Chionwara. She's 55, and she is a Labour MP for Newcastle upon Tyne Central, as well as serving as the Shadow Minister for Science, Research, and Medical. So each of these different kind of personas has a few different sections. One is around their kind of background, their childhood, and how they grew up and how they ended up being an MP. Some of them has their goals, so thinking about what they want to do in their position, what their all-party parliamentary group wants to do, what some of her goals might be. And with these different personas, I've done quite a lot of research into finding out more about them, and listened to some of the BBC profile episodes and dug into a bit of this. But as well as thinking about kind of enablers and what the position of MP might entail, and what some of the kind of enablers to achieving her goals might be, and barriers maybe within her political context. So that's Chionwara. In government, we can think about government in several different kind of ways, right? There's local government, there's central government, there's different regional government bodies. But the persona here we'll be using is Chris Whitty, who might be familiar to some of us, the Chief Medical Officer for England, the Chief Medical Advisor to Government, and Chief Scientific Advisor for Department of Health and Social Care. We'll probably recognize him from some of the government kind of decision makings around COVID-19. And so again, here we have the who am I, the motivations, goals, enablers, and barriers. And last but not least, we have third sector. And here I'm kind of drawing close to home with Nesta's own CEO, Ravi Gurmurthy. And so we can think about Nesta as a funding body of itself, interested in as a third sector body in promoting different outcomes, and filling different gaps, and helping kind of strengthen government response in particular problem areas. So basically, in our breakout groups, I'm actually going to give us a little bit more time for this, so around 20 minutes. What we'll do is, if you could each take time to read the different personas, and maybe as a group kind of decide which one you'd like to respond to, whether it be government, whether it be parliament, whether it be the third sector, and think about how your pitch may be different depending on these audiences. So reading through their background, their enablers, their facilitators to achieving what their goals are. Explore a bit about the different hopes and fears of engaging with these audiences. What do you think might be able to help? How might you engage with them? What additional information do you want to use? Would you like to find out about them? And then come up with 3 adjustments or potential adjustments to your research pitch based upon what you've learned. So I might recommend about maybe 7 minutes reading through the different personas and thinking about them. And then the rest of the time, around 13 minutes, thinking about how your pitch might differ, and thinking back again to our kind of overview logic model and some of the different direct causes and consequences. What's that common ground that you might use to develop this and to inform this? With this kind of navigating our audience, I realize we all could have focused on the same person, but I think it hopefully it's just a kind of good reflection upon thinking about what are the different circles that these people might operate in. What are the different policy problems, both big scale and smaller scale, that you could use as that common hook? How might you demonstrate that common understanding or common language with the person that you're engaging with? And we do have a tool for you in the course pack, a persona tool for you to use if you are thinking about engaging with someone, or even an institution. Think about who that person is, what their motivations are, what might be those access points, those touch points through which you can start having that conversation with them. So I realize we have only a few minutes left. We have quite a few kind of case studies that we weren't able to share just for the sake of time, but I'll make sure to share those all with you but as we go. And I think thinking about different ways of engaging with charities, with local government, as well as an additional activity for you to take home, which is the thinking about the stakeholders within your own network, and thinking about how you might think about who are the different people that you might want to engage with. Is it a public body? Is it a different network? How might you map that out? So in the worksheet, there's this kind of stakeholder mapping exercise. Maybe this can be kind of like a post-session take-home, just to get out onto paper or onto Google Slides, as it were, those people in your network and how that might relate. And we can think about this again, even in the context of Chris Whitty, who would be in his network and how might we access that through that. I'm gonna go over to Audrey, who has a couple slides that she wants to share with everyone, and then we can kind of wrap up the course for the day.
Yeah, so I just wanted to pull together some resources for people. So across UCL in SLIMS, there's the Academic Careers Office, which right now is offering translational research training as part of the Accelerate program. And so this link, and I'll share these slides so that you have all of the direct links, but this is providing some really interesting training, like on entrepreneurial skills, how do you pitch your research, so similar to what we've already been covering here, but I think it's worth taking a look. And then there's also the research domains. I'm not sure if you're familiar with those, but each domain sort of cross-cuts different topic areas. And each one has an early career research network and a lot of these networks put on their own training or host their own events and have their own newsletters. So I've included links to each of the domain's early career research networks, as well as the names of the early career research network chairs. And I've been in touch with pretty much all of them, and they're all really lovely and very approachable. So those are definitely some networks that are worth getting involved with.
Here we have some resources, tips, and opportunities for engaging with parliamentarians, government, and third sector.